Hi, I'm Alice Lee and I'm a holistic and integrative psychiatrist. Today I wanted to cover 5 reasons why I think holistic psychiatry is superior to a more conventional approach. I was a conventional psychiatrist for about 8 years before I was introduced to a holistic and integrative approach in 2002. And I've been practicing as a holistic and integrative psychiatrist for 17 years, since 2002. And so I am able to compare my clinical experiences as a regular psychiatrist versus my clinical experiences as a holistic psychiatrist, and be able to see that a holistic psychiatry approach is superior. The 5 reasons why I think it's superior is: number 1, overall the clinical outcomes are superior. I'll go over the reasons why. 2, holistic approaches is based on proper biochemical understanding of the human body's functioning. Number 3, holistic approaches doesn't introduce foreign substances, xenobiotics, into the body. They use more natural substances. Number 4, holistic approaches address the consequences of environmental changes that have a negative impact on our health. And number 5, it doesn't cause dependency. The person is able to use a holistic approach, heal from their underlying problems, and be able to move on with their lives. So these are the top reasons why I think a holistic approach is better. Let me just explain maybe each one in a little bit more detail. Number 1, the overall clinical outcomes are superior. I can say that as a clinician, because now, after practicing holistically, my practice has really changed from having patients come in and putting them on medications and having them become basically patients for life, because I'm always giving them medications, to a practice where I'm working with my patients, they get better, and then they leave. So my practice has changed in terms of its turnover of patients. Patients come in, they work on restoring their health. When they're better, they leave, and I have to take on new patients. So it's a little bit more work for me, but it's what I prefer, instead of having patients be constantly dependent on a medication. I do find also that the clinical approaches result in faster recovery and less side effects as well. So to me, if you know enough about holistic and integrative approaches, you can get really good outcomes, and they can happen very quickly with simple interventions, especially if you have not started medication when you start these holistic interventions. Medications can prolong how long it takes to get better, but it still can be done. Number 2, it's based on proper biochemical understanding of the human body and its functioning. In a holistic and integrative approach, a doctor is concerned about the patient's underlying health in terms of oxidative stress, inflammation, infection, toxins. We're really interested in understanding what are the underlying causes for these symptoms. We are not treating symptoms, we're treating underlying causes for those symptoms. In conventional psychiatry, it's more symptom-based. You come in with depression, you get an antidepressant. You come in with psychosis, you get an antipsychotic. There's not this understanding of, what is going on with this patient that could be causing this particular symptom. It's just really, it just gets narrowed down to the medication. The third one is it does not introduce xenobiotics into the body. A xenobiotic, or the word xenobiotic, means that it's a foreign substance. This is how pharmaceutical companies get patents. They create xenobiotics. They create something so new, so refined, that it's not found in nature. And when you introduce something like that into the body doesn't recognize it as something familiar either. It's new, and when a body sees something that, even if it mimics like a neurotransmitter, it's still different. It's not identical. And so the body is very smart. So ultimately it knows that you are taking a foreign substance, and that will trigger an immune reaction, which creates inflammation, more inflammation. And it will also stress the body's detoxification system as the body tries to detoxify from this medication. When you help the body build whatever it is that it needs using natural approaches, you don't encounter that problem. The third reason, or the fourth reason that it's superior, holistic approaches are superior, is because it addresses the consequences of environmental changes and their impact on our health. So in The Healing Power of Minerals by Paul Bergner, he talked about the saying, an apple a day keeps the doctor away. And he was presenting data about the mineral content, the iron mineral content in an apple in 1914 versus an apple in 1997. And the difference was that one apple in 1914 was equal to 26 apples in 1997, and you can imagine how many apples that might equal now, since it's not 1997 anymore. So you can imagine that the nutrient content of foods has been being reduced over time, and therefore the raw materials that our body needs to function has been reduced. When that happens, certain functions of the body is not going to be working as well. And so taking nutritional supports makes sense. Fifth reason, it doesn't cause dependencies. There is depletion of neurotransmitters when we take psychotropic medications. I was at a holistic medicine conference, a holistic mental health conference, where Dr. Martin Hinz, H-I-N-Z, presented. He actually has 2 patents in the creation of SSRIs. These are the antidepressants that most people take. And he was presenting on really why he felt it was important for people to try a holistic approach first before they try a medication. And what he said was that first he taught us that platelets contain 90% of the releasable serotonin storage levels in our body. And that reuptake inhibitors such as Zoloft or Prozac or Celexa, they show that when you introduce a reuptake inhibitor, 90% of the platelet serotonin is depleted in about 3 weeks. And over 80% of the total releasable serotonin is depleted within 3 weeks after starting reuptake inhibitors. So what that means is after you start taking an antidepressant or other medications that do similar things, such as block the reuptake of certain neurotransmitters, that the storage level of those neurotransmitters will plummet. And when those storage levels go down, you're going to have less neurotransmitters to work with, and of course you are now more dependent on the medication to intervene for you so that you can actually function normally. And so it creates a cycle of dependency, which I think a holistic approach avoids. A holistic and integrative psychiatrist will provide a patient with the raw materials to build those neurotransmitters, to replete or to increase the storage levels of those neurotransmitters through nutritional interventions, which makes a lot of sense to me. And I do see positive outcomes from doing that, because a lot of patients come to me to help them get off their antidepressants, and I'm able to help them do that using nutritional supports when they couldn't do that on their own. And that's because we work on repleting their storage levels of neurotransmitters before we try to lower their medications. And they didn't know how to do that by themselves. So those are the 5 reasons. I hope that by explaining this to you that you'll be more open to using a holistic and integrative approach rather than a conventional approach when you're thinking about treatment for any kind of mental health problems, either for yourself or for a loved one. And I hope that that you'll contact me or email me if you have any questions. My holistic website is called holisticspsychiatrist.com. So I hope you visit that website. There's a lot of information on there about medication withdrawal. So thank you so much for listening, and I hope you have a great day.